I am at least 18 years old and I consent to being videotaped for the medication administration skills return demonstration video.
I'm going to start in the med room, perform hand hygiene. I'm going to compare the MAR with the provider's orders, make sure there's no discrepancies. And I'm going to verify the client's name by comparing the MAR to the order sheet, as well as their date of birth. I'm going to also check the chart and the MAR, see if the client has any drug allergies or contraindications to receiving their medications today. I'm going to determine next which medications need to be administered. So we have the digoxin, 125 microgram tablet by mouth daily. It's due at 0700. And the Humulin R subcutaneous is per sliding scale. And the AccuCheck was taken this morning, came out to 256, which tells us the client's going to need 3 units. So I'm going to go ahead and grab those. I'm going to do my first medication check. So I have digoxin. This is the right drug, 125 micrograms. It's the right dose. It's an oral tablet, and it's to be given by mouth, so right route. And the time to be given is 0700, so it's correct time. The expiration date is February 2022. Next I have the insulin. I have Humulin R, so it's the correct drug. The dose is 3 units. We have 100 units per 10 milliliters, so we're going to do the medication calculation for that to get that dose in milliliters. We have to be given subcutaneously, so I have the vial and a insulin syringe with the subcutaneous needle. And right time, it's sliding scale, so it's dependent on that blood sugar, which was taken and it was high. So I'm going to go ahead and do the medication calculation for the insulin. The vial is 100 units and 10 milliliters, and the order is 3 units. So after doing the medication calculation, it comes out to 0.3 milliliters. I would have another RN come in and check my calculation by doing it on their own, and then verifying that we got the same amount and that I drew up the 0.3 milliliters of insulin. So I'm going to go ahead and draw up the medication. I'm going to rub the top of the vial for 15 seconds with an alcohol wipe. Then I'm going to draw up 0.3 milliliters of air into the syringe. And I'm going to inject that into the vial. That over. Then I'm going to draw up the 0.3 milliliters of insulin. Okay. And then I'm going to use a one-handed swoop method to recap that needle, set it aside. And next I'm going to get the digoxin ready. I'm going to leave it closed, and I'm just going to place it in this med cup. And I'm going to now do my second medication check. So I have digoxin, it's correct drug, 125 micrograms, correct dose. It is an oral tablet. It was ordered to be a tablet by mouth, correct route, and it's due right now at 0700, so correct time. For the insulin, we have the Humulin R insulin, so correct drug. We drew up 0.3 milliliters, so correct dose. It's to be given subcutaneously. I do have a subcutaneous needle, so correct route, and it is due. It's a sliding scale, so again dependent on the glucose level, which is 256, so it is the indicated that the client should receive it now. So I'm going to go ahead and take my MAR and my medications to the patient's room.
Come in.
Hi.
Hello.
My name is Mackenzie. I'm going to be your nurse today. I'm going to perform hand hygiene here and provide some privacy for us. Could you confirm your name? Tell me your name and date of birth.
Vivian Savoya, 9/21/1970.
Okay. And I just have to give you 2 medications today. Can you tell me, do you have any allergies?
No.
No? Okay. Okay, and do you have any reason that you shouldn't be taking medications today that you know of?
No.
Okay. So the medications I have today, the first is going to be digoxin.
Okay.
It's a pill you're going to take by mouth with some water. It's used to improve the way your heart pumps blood. So it does decrease your heart rate and increase your cardiac output.
Okay.
Because of that, we're going to check your heart rate for a full minute before we administer the medication.
Okay.
One of the adverse effects we look for is digoxin toxicity. So we monitor your blood tests for that to check your digoxin level. So some signs and symptoms of that are blurred vision, altered colors in your vision, or seeing yellow halos, as well as nausea, vomiting, diarrhea, confusion, and an irregular heartbeat.
Okay.
The second medication is going to be Humulin R. It's an insulin, a regular short-acting insulin. It's given to diabetic patients to control their blood sugar. Okay. One of the adverse effects we look at for that is lipohypertrophy. It's an accumulation of fat. It creates a lump at the injection site, but we try to rotate sites with injection to avoid that.
Okay.
And then the more serious adverse effect would be hypoglycemia, which is a drop in your blood sugar levels. So you might notice shakiness, confusion, irritability, hunger, and again, irregular heartbeats.
Okay.
Did you have any questions about either of those medications?
No.
Okay. Do you have any problem swallowing pills?
No.
Okay. I'm just going to have you take a sip of this water, and I'm just going to evaluate your swallowing reflex. Okay. Yeah. And I'm going to go ahead and check your heart rate real quick, okay? So I'm going to listen for a full minute.
Okay.
It's like right here. It's your apical heart rate. Okay, so I got your heart rate at 75. So again, we just look for it to be over 60, so that's good. We can go ahead and administer that. I'm gonna, before we administer anything, I'm gonna do one more medication check just to make sure I have the right drug and the right dose and everything.
Okay.
Okay, I'm gonna start with the digoxin. So I have digoxin, it's the right drug, 125 micrograms, right dose. It's to be given by mouth, so it is an oral tablet, and it's due right now at 0700. And the insulin is Humulin R, so it's right drug. 0.3 milliliters, so it's the right dose. Subcutaneous, so we do have a subcutaneous needle. So correct route, and then we do give it, because it's a sliding scale order based on your AccuCheck. Your blood glucose this morning was 256, so it's a little high, which indicates that you need the insulin.
Okay.
Do you have any preference for which medication we do first?
No.
Okay. We're going to start with the insulin. I'm going to go ahead and perform hand hygiene here.
Okay.
Move some stuff. Okay, I'm going to perform hand hygiene and put on some gloves here. So then I would normally lay the patient down or sit them back, and then I would lift their shirt to expose the abdomen. Then I would assess the site for any lesions or trauma or inflammation or any bony prominences. I would also, palpate the site to determine what angle I'm going to inject the needle at. I would inject it, in this case, at a 90-degree angle. So I'm going to go ahead and clean the area. I would start about an inch away from the umbilicus, start at the center with an antimicrobial wipe in a circular motion, moving outward about 2 inches. I'm then going to uncap the needle and grasp the site. I'm going to let the patient know you're going to feel a little pinch. I'm going to insert the needle at a 90-degree angle. Go ahead and ungrasp the skin and hold the syringe and inject the medication. And then I'm going to pull the needle out, keeping it at the 90-degree angle. And I'm going to put some gauze over the injection site and activate the safety mechanism on the needle and drop that in the sharp spin. And then I'm going to I'm going to observe the injection site for any redness, bleeding, or signs of reaction. And then I would apply a adhesive bandage to the client's abdomen. And I'm going to go ahead and throw away the antimicrobial wipe and the gauze and my gloves into the trash can. And then I would perform hand hygiene again and set the patient back up to about a 30-degree angle in bed. So next we're going to administer the digoxin. So I'm going to go ahead and give you this. I'm going to open the medication and put it in the medication cup.
Okay.
And let you take that. And whenever you're ready, you can take that. So the patient took the medication and swallowed the medication. So I'm going to take the medication wrapper and the medication cup and throw that away. Take that. Okay. I'm going to perform hand hygiene again here. Okay, so that's all we had to do today. I would go ahead and lower the bed back to the lowest position, make sure the bed is locked, side rails up, call light within reach. Ask the patient, is there anything else I can do for you today?
No.
Okay, if you need anything, just push your call button and we'll be in to help you, okay?
Okay. Thank you.
Perform hand hygiene one more time.
All right.